Good morning, everyone. I'm Holly Freishtat. I am the Senior Director for Feeding Change at the Milken Institute. I am just pleased to have Steve Brophy, is the Vice President of Public Policy and Government Affairs at Dollar General, and Gordon Reid is the the former president of Stop and Shop, retiring in 2025. He just stepped down recently. Thank you for being here to listen. I was counting a second ago, I think we're like the number 11 speaker when you add up the last 2 hours and how many amazing people we've had. So my job here is to be entertaining, to be conversational. We've heard so many different ways in which retail needs to happen in this nation, right? All different size stores, all different kinds of models. And we need to think about what kinds of models need to work where and where does success lie. So before I start to set this in a little deeper, just quickly some background on me. I used to work for the city of Baltimore as the chief of food policy and planning for around 11 years, worked on a food desert retail strategy, worked on COVID-19 security response, worked on so many different aspects of food retail. Many amazing people from the city of Baltimore and Hopkins and other partners are here today. None of this can happen without a ton of partnerships, and we'll see that as a theme. So food retail, I would say I've actually worked in retail, but I've never operated and run a store, but I would say I'm as hot as you can get with the love and joy of food retail. So what I really would love to do is start with kind of understanding what the retail environment looks like. We can always make assumptions and go, oh, well, if they only could do this, we know better than that. So let's hear directly from each one of you. And I want to start with you, Gordon, tell me about Stop and Shop and Alcohol Delays and kind of the format, the size, the scale, where are your stores, and just give us a quick overview.
Okay. Stop and Shop's part of Alcohol Delays in the US. We have 5 brands. We have Hannaford, Stop and Shop, Giant Food, which I ran for 6 years here, Giant Tour in Pennsylvania, and also Food Line all the way down the East Coast. Stop and Shop has 370 stores. Average about 55,000 square feet, over 50,000 SKUs in each store. Varies from $350,000, $400,000 a store up to a couple of million each week. So it's a big variety. And we go all the way from Massachusetts down to New Jersey, through New York and the Bronx and Brooklyn. And yeah, we've been around for 110 years or so, and obviously seen a lot of changes in that time.
Great, thank you. So just to kind of lift up a few things. So large format stores, not super center, but large format grocery store. And on average, like when someone comes in to go shopping, what kind of basket size are you seeing as far as the amount of food and the dollars? And tell me a little bit of, like, you know, flow into underserved communities. What are you seeing in kind of shopping patterns, frequency, basket size?
Gosh, average sort of basket's about $130. And it varies again just quite dramatically. We serve about 6 million people every week, 6 million transactions. Yeah, we're seeing sort of the last 5 years been through COVID, through all the sort of changes that are happening, and that's been, you know, a very dynamic environment that we've been in. Sort of given us lots of challenges. I think Leslie mentioned earlier about the profitability of businesses. You know, our global CEO will tell you that Apple delays globally makes 4 cents on the dollar. And so a bit better than sort of Leslie's 1.6, but you know, it's every sort of penny is important. And you know, we're seeing the underserved communities. We have been involved in donations to food banks for, you know, all of our history really. And we've seen that really change dramatically over the last 5 years as food as medicine has become a much stronger and a much bigger movement. And we have changed from just donating food, you know, like we used to. We still do that. We support 11 food banks across our footprint, but also we're doing a lot of initiatives to actually sort of support local communities in a different way.
Great, thank you. All right, so Steve, I want you to share with me, I know I like when you said this to me earlier, America's neighborhood general store. So when you think about Dollar General, you guys talk about being a general store, and food and produce has been a more recent addition. So talk to me a little bit about your model and size. Where are you located? What is your size? What communities do you serve in the big picture? We'll go into more details as we talk there.
Sounds good. Thank you, Holly. And I have to first admit that I'm incredibly nervous because I'm a kid from Nashville, Tennessee, and I'm on a stage and I got a microphone and I may break out into songs. So don't judge me at all.
We're supposed to entertain.
Yeah, exactly. And I want to thank Stacy and Ambassador Cousins and our good friends at FMI, Jennifer and Leslie as well. I doubt many of you all have seen a kid from Dollar General coming up and talking to you all about the kind of food stuff. We're new to the game, and it's the coaching and tutelage that I benefit from FMI that has been incredibly helpful to us. Dollar General, we trace our roots back to 1939 when J.L. Turner and his son were trying to provide cost-effective means of general goods to all of the rural neighbors out near Scottsville, Kentucky. Now we have turned into the largest, by store count, the largest general merchant chain in the country with over 20,000 stores. As I began at Dollar General after being here for 20 years, working on the Hill and doing some other government stuff, coming to Dollar General to take on all of their government affairs responsibilities at the state, federal, and local level. And when I got to Dollar General, our stores, and I'll mention the format. So our store at that point was very small format, 9,100 square feet. We have now grown into a series of other formats, our largest of which is 12,000 square feet. So a drop in the bucket to the big boys here. And then in 2017, 18, we realized how much our customers were looking to us for food and healthy food alternatives. And so we took on two major expansions to the business. One was, again, when I started, we had 5 cooler doors in our stores. We now have on average 34, upwards of 55 coolers and refrigerators of product for our customers. And then shortly thereafter, we began the push for fresh produce. And now we have 6,500 stores that are offering fresh produce.
Great. And tell me a little bit about your basket size. When someone shops, how much are they buying? How much are they spending? How often do they come in?
So our core customer is coming in more frequently. The basket size is under $20 typically as they're coming in. They'll be coming in a couple of times a week, I believe.
Great. So you heard that 17 to 25, 130, give or take, for shopping size. So this is actually one of my favorite parts. So one of the points of today's conversation is really looking at the assets, the asset lens of looking at food retail. You know, when I worked for the city of Baltimore, at first we had a food desert retail strategy and then realized that the strategy may be strong, but the terminology sure is not. And so we moved into healthy food priority areas, really looking at how do you be asset based and focus on what we want to accomplish, not what we don't have. But with all these strategies and all these retail, evolutions, it's always been a little, black and white or bipolar or just very much linear of, one store or the other, right? It's like a big store or a small store, or I can't get this store, but I can get that store. But what I want to talk about right now is how the stores work together. And this is probably the most important part. It's not about one or the other. It's about how they complement each other and how do they work together. So I want to open it up to both of you and talk about this interrelationship between a large format store, a smaller store, and how do these work together? I mean, I know, of course, they're competitors, but often you're not. You're both ends. So I would love to hear a little bit about this relationship. And it's not that you just these stores, large format store versus like kind of a smaller format.
But I think in our stores, the biggest sort of driver is convenience. So people visit because there's the grocery store because it's most convenient to them normally, and then you have your favorite stores. But then again, I think depending on the different communities, you have corner stores that people pop in and just top up their shopping, and then people will come to us and do sort of their full week shop. But we also have the largest drop-in small basket, sort of customers coming in, people coming in for ready meals that are ready, the different sort of things that we offer at lunch times and sort of use our stores that way. And I think it really is just a top-up visit in other areas. Yeah.
So we were born in the concept of the pop in and top off, which sounds a whole lot better in with a Scottish accent. And so that's been our entire philosophy. We're not looking for that big ticket 3-digit figure coming off the register. And so for us, it was you get your paycheck, you lucky enough to go to a Giant or a Stop and Shop, you spend your money there. And it's as you're running out of certain things, you stop by and you pick up that bottle of ketchup or something that's needed for dinner. And now recently we've been able, if you've forgotten the onion or you need something, instead of going and making that whole huge trip, you can just stop in and top off.
And so I think, as, retail has continued to evolve, where Dollar General was more, shelf stable and now a tremendous more amount of produce. So now, not only does topping off mean you can just get some more fresh produce and you don't have to resort to other, more stable foods during the month, and shopping patterns. This brings us to the next question, really looking at, going back to sort of the city, we were working on so much of the brick and mortar experience, right? Because that's what we had. And in this evolution of the last, 5 to 10 years, really, online SNAP and kind of omni-channel experience has really changed retail and changed the shoppers' preferences and kind of patterns. So I want to start with you, Gordon, first, and talk to me a little bit about what does it mean to have an omni-channel experience? How are the consumers coming in? What are they buying online? What are they buying in store?
Yeah. No, I think, if I go back, I've been in the States 11 years, and when I started in Giant Food, we had zero click and collect business. We had like very limited online business. We had a Peapod, sort of delivery service that was an inherited business or a business we bought, but very, very kind of old fashioned in its setup. And in the matter of 5 years, we had every single store with a click and collect business. We've changed the whole sort of setup from the Peapod sort of central warehousing to mostly click and collect. We also work with a relationship with Instacart, where you can go on the Instacart market. We've done DoorDash as well now. And so it really has evolved dramatically. And the omnichannel customer is a much sort of bigger shopper with us. So, that's almost twice what you would spend in just a normal sort of store shopper. And, when we got into COVID, then obviously that was a lifeline for a lot of people, people who were trying to come out. And we also worked really hard to put SNAP online, and we were the first retailer in Massachusetts to get SNAP online, which made a big difference to our customers. Because often, again, the communities that we serve, people have to take 2 buses to get to a grocery store, or they take a taxi, and that's expensive. So the fact that you have online shopping really sort of has picked up, and we see a lot of SNAP, benefits coming through online shopping.
Great. So online SNAP. So I remember very clearly one of my first days working for the city of Baltimore. We were working on getting online SNAP. 11 years later, right during COVID, online SNAP was in the stores in the state of Maryland. That was for 11 years. That's a very long time. But in that process, and we've seen this across the nation, but now that the uptick, it's really starting to see online SNAP purchasing. So talk to me a little bit more about, are you seeing sort of patterns on SNAP of what is being bought online versus what's being in store?
Yeah, I think obviously the movement, food is medicine has really sort of revolutionized, I think are starting to get people to think a lot differently. And people really, you can start to see people wanting to eat healthily. And I think the whole, in our business, we have dietitians in our stores, we have a central team who sort of provide healthy recommendations. And just generally in society, I think the whole, food is medicine, the way after COVID, I think that they focus on, obesity, diabetes, etc., really sort of had, people getting a lot more advice, a lot more sort of focus on how do you eat sort of healthily. And so I think you get into produce, and fresh product is something that's key to the change that's happening.
Great. So I want to kind of go a little further here on sort of online SNAP and SNAP is omni-channel. And just for, I think most everyone here may know this, but omni-channel experience. So when you think about omnichannel, it's shopping online, it's going into the store, it's that back and forth shopping pattern. And then when you also think about shopping patterns for online stuff, it used to be you had to go into the store, right? And also, with WIC going into the store. So when you rent, you try to shop as much as you can. Right, it was a one-time kind of shop. It's hard to get to the store, whatever it may be. But when you start to bring in online stuff and eWIC where it's available, is you start to see a changing in shopping habits. Right, you can buy some of it online. It can be delivered. You can go into the store. And so what we're really striving for now is this seamless omni-channel experience, where it's very easy and fluid for the consumer to be able to go back and forth. And when it's convenient and easier for them to be online, they do. And when not, they go into the store. Do you want to jump into that?
No, and I think that, the online has given us the ability to do filtered shopping lists can be by the diabetes, whatever, and so you can go in and actually sort of select product that really is healthy for you. So again, just go back into that evolution of online is just getting sharper and sharper as you go forward. And that's a big thing for customers, and it gives them that ability to get, a shopping list that is relevant to the disease that they may have.
Great. So, Steve, I want to hear from you of looking at sort of healthy choice as the easier choice. Like, we need to make this easier. And I know you guys are thinking every single day, how do we make the easy choice the healthy choice? How do we make it seamless? One day I broke my glasses and my 6-year-old at the time how to read the labels. And, it was mediocre at best. Or maybe not even that. And even when you do have your glasses, it's still very complicated. And so talk to me about how you're making the easier choice, the healthier choice is better for you.
Oh, absolutely. Thank you. So, 2019, I was visited in short succession by the Center for Disease Control, who sat down and had not been in a store with fresh produce at all, but sat down and said, I know Dollar General. You can eat healthy at a Dollar General if you know how, with the biggest part of that, helping people find those behavioral economics, the right kind of nudges to help guide them towards what is the better choice for them. Based on that, the next thing that happened right after by serendipity is that my CEO got a recipe book from a nutritionist whose school project for her master's was to put together a series of different recipes, not complete meal, but they complements all of them, about 30 different recipes that were all sourced at Dollar General, all cost effective and easy to make. And so we incorporated those two things. We used the nutritionist to help us set our standard. We refer to it as better for you. And so she kind of went to Heart Association, Diabetes Association, Department of Agriculture, and created for us a standard by which we think about what we can now label as our better for you and start those nudging processes. So we have then systematically gone through, and I'm a part of these conversations, gone systematically through all of our food assortment to determine whether or not it meets that standard of low fat, low sugar, low salt, those types of things. The cooler thing that I think we've been able to do is engage that nutritionist now on helping our buyers identify the nutritional trade-offs, not just the financial trade-offs. And so that has been a really nice thing for us to do. We post all of those are labeled on the shelf. Candidly, I think it's a little more subdued than I'd like, and I'm working on that with my marketing folks. Excuse me, we have all the recipes posted online. We continue to refine those as well, and we're making sure that they taste good, and not just because people need to adopt that type of a choice for themselves.
So how are you taking into consideration cultural appropriateness and also the community specifically where the stores are to meet the cultural and dietary needs and desires?
That's an outstanding question, and I would say it's a work in progress to a large extent. And so the thought process, again, we're a 9,100 foot store, which, tell me your square footage again. 55. So our fresh produce, kind of the hallmark, is basically 16 feet of fresh produce with 8 feet of ambient, 8 feet of chilled produce. It accommodates about 80% of what people go into a bigger grocery store to buy. And so we do have some level of limitations there. We do have culturally specific areas of the store to be able to turn those into the meals that they want. But again, we started in produce in 2018, 2019. And so this is part of our growth. We're in a process, you probably self-distribute, I assume.
Yeah.
We're still in that sense of using and leveraging our distributors to be able to get our fresh product to us in each of those 6,500 stores.
Great. And Gordon, I want to hear about guiding stars.
Sure.
And I'll hold always at large and then also Stop and Shop. What is it? Why do you guys do it? What is food scoring? How lay out the land for us?
Sure. I mean, we have a system called Guiding Stars. And every product in our store, including national brands, get like 0 stars, 1, 2, or 3 stars, depending on how healthy it is. It's based on FDA guidance and algorithm that we update regularly based on different guidance. And so when a customer is shopping, then they can look at the shelf, if it has a guiding a star. If you're looking at yogurt and you see one without a star or one with a star, then choose the one with a star because it's healthier and it's in a better quality product. And we use that to target. We set we're incentivized on a healthy sales target. So up until now, it's been on our private brand. So 60% of our private brand sales are on a healthy products, and that's at least 1 star. And we're in the next couple of years, we'll move into total store. So we'll include the national brands in that target, and so we'll influence our suppliers to start moving towards healthier formulations and healthy, so to provide healthy choices. And I say, every store has a target. We're incentivized on it. Our store managers are incentivized on it. So we're serious about delivering on health for our customers.
So to recap, you're taking all the data of all the different products.
Yeah.
And then you're scoring them, and then you're simplifying it for the consumers to a 1 to 5 star. And then you're nudging them to the healthier choice. Is that correct?
It is, yeah. And we'd be happy to share that with other retailers or anyone who's interested.
And then you mentioned shelf labels. Is it also online? Like, can you check on your phone and check your guiding stars? How does it work?
Yeah, you can look up in the product online and see if it's got stars associated with it.
So this brings to another really important theme here. I'm looking at this role of technology and data and synthesizing the data and the SKUs to be able to make it easier for us to know which foods to eat and not have to read every single label every single time. And then be able to see and track it. And what we're starting to see with some trends with retailers is being able to have more consistency, whether you're calling them stars or a different label. We're starting to see more synthesis to make it easier for consumers. And so this brings me to the next piece. When you look at online SNAP, and you were talking a little earlier about, well, you can start to curate that shopping cart. You can start to, like, as they're shopping, kind of nudge them electronically, and also sort of look at nutrition incentives, whether it's, produce incentives related to online SNAP or whatever it may be. Can you talk a little bit more of what is looking like at your stores?
In relation to, sorry.
So, like, this is sort of a technology change we're seeing. So if someone goes on, and we'll just give an example of whether it's, trying to help people understand what foods they can get online for online SNAP, and say helping them to understand the different produce that may be available and so forth. Explain to me sort of that technology side behind us, making it easier for the consumer to choose a healthier choice online.
Well, our sort of online system, if you like, is constantly updated, so the team are looking at it regularly. Again, anything that changes, any different views we have on guiding stars, new product coming in, or promotions, changes on a daily, weekly basis. Right? And as I say, a big part at the moment is we have by sort of disease class, you can sort of search for better recipes, and product that you want to buy.
So this is, now I'm going to put on my other hat. So at the Milken Institute, lead the food system portfolio, but more specifically, we do a tremendous amount of research, and many of you guys have been involved in this, related to food as medicine. And food as medicine has really more recently become an umbrella. it's become a movement, it's become a theme. At first, it was very much specific, produce prescription, medically tailored meals, medically tailored groceries, nutrition, registered dietitians and nutrition education. And yes, it is all that, but more. It's becoming this movement of making it easy for people to understand and have food be a part of a treatment and prevention to their health conditions. And also we're seeing, more Medicaid 1115 waivers on food as medicine. We're seeing Medicare Advantage, and we're starting to see this play out in our stores. We released a report last June on the role of pharmacies in providing food as medicine care. Yeah. And so not just the food, but also the care providers. So talk to me a little bit more about, I'll hold it at large, stop and shop around the role of pharmacies in care of food as medicine.
Yeah. So we have, a large pharmacy business, and what we try and do is when people come in for medications for diabetes or heart disease, can we give them some nutritional information at the same time? Always we do webinars as well with our nutritionists to try and help people. I'm trying to think. Yeah, so I think, basically there's, sorry, I lost my...
Yeah, so the prompt here is, one, I started getting passionate on food as medicine around 12 years ago, and it was because I went to the Giants in DC. So you guys are helping to really start kind of this movement and trend a long time ago and are continuing to do so in many formats. Is that correct?
No, it is. And as I say, I think it's something that's evolved, and especially the last 5 years. So you go back and it was just donations of food, but now I think we're getting into we work with Fresh Connect, say up in Boston, which is part of the Brigham Health sort of connection. So we donated $75,000 to them to sort of start the program. And again, they give prescriptions for food for people in the community. And we're seeing more of that happening. A big thing recently was we took on the Nature's Benefit Card, where people can come into the store. They have a card loaded with benefits. One of the challenges with that is that every card that comes out has a different IT requirement. So every time something comes along, we have to sort of redo our system, which becomes very, very difficult. So if anybody's got an influence and you can get like one system, would be fantastic rather than everybody doing something different.
I'm laughing on that one. We released a report on market-based solutions for scaling food as medicine. If you guys remember one thing around the challenges is interoperability. It is absolutely impossible right now. There's a million different cards for a million different foods in a million different communities, and they are not interoperable. And also, the being able to understand the data from the retailer side of the teller versus the insurance company maybe paying for it versus everyone in between. Interoperability is definitely an issue, and we're seeing this across, with the food retailers, making sure all our data is able to be exchanged. But I'm sorry, Steve, I didn't mean to leave you out for so long. But I really want to bring this back to the healthier choice, easier choice. But when you think about where we are because of COVID, right? We saw food insecurity was high before COVID. It escalated during COVID. And to be honest, it's still really hot. And so talk to me a little bit of how you're thinking through addressing food insecurity, not just from federal benefits of SNAP, but where do you want to go in the future? How are you thinking about WIC? What are the opportunities? What are the challenges? I would love to hear kind of some of your pathways of thought.
Yeah, I appreciate that. And I've taken a lot of notes mentally on what you said because we're at a lower stage right now of thinking through those processes. So what you're doing is incredible. COVID, I don't know if you all heard of it, but it was in the news. It was a shock wave, especially to all retailers, especially to us who are in, we're in 80% of our stores are in communities of 20,000 or less. And so we're very much in those rules. If there's a blinking stoplight, it's probably shining on a Dollar General banner out there. And so we're playing a significant role in that part of the country as we were trying to stay open, maintain the right kind of products that people actually needed out there to do it in not only a respectful, but a very clean and mutually beneficial process. I was on that team of 5 of us that were dealing with COVID as it first started. And frankly, I was blessed to get the task of trying to get COVID vaccines into our parking lots to help get beyond the pandemic, especially in not only health deserts, but not only food deserts, but there are healthcare deserts out there as well. And so that helped it give all of us at Dollar General. It was a very successful program. We didn't charge a dime for it, glad to have done it. But it also kind of registered the need for our customer, how they think about their own health, and where we can play a role in that. And so the merchants went off and optimized our over-the-counter section. We don't do pharmacies in our stores, but they did that. We actually hired a chief medical officer who came in and tried to do a lot of cool things. One of the things he did relative specifically to food as medicine deals with partnering with various insurance mediums to be able to use the insurance cards to be able to address the food as medicine prescription.
So are you referring to over-the-counter cards, the OTC cards? Is that what you're referring to? I think you are.
This is where panic says.
So here, I think I'm going to tie the thing here for you. So when you look at how people can get food, of course, it's mapped through WIC, there's many mechanisms, but with food as medicine, you look at kind of this continuum of food as medicine. You have the 1115 waivers of Medicaid, right? And there's certain states that have Medicaid waivers, meaning that you'll be able to go maybe to a grocery store or wherever you may be able to get certain foods for nutrition support. So Medicare Advantage also has a supplemental benefit for the chronically ill and also over-the-counter cards. Those are all ways to be able to get people to choose the types of foods that they would like to promote specifically their health. And so we're really starting to see this change of, and we've been seeing this for a while, that people are coming into the stores for their health and their food and their health care. And I would love to hear a little bit more. We were talking earlier and you said to me, I wish we could, or I would like to see WIC in our stores. So, from the city side of working in the city, I know what it takes to be able to move some of these, but I would like everyone else to kind of understand when you're thinking about WIC, what are those challenges you're seeing and where are you trying to get that opportunity?
Well, I don't have any breaking news for the brand on WIC, but it is a problem as a public policy guy and a former government staffer. It's one of those, man, wouldn't it be great if, in order for us the impediments to WIC in terms of a business model like ours, a small box retailer, there are a couple of things. One, probably the cheap one, is the lack of harmonization within the assortment requirements state by state. So you all know this better than I do, but it's federally funded, but state driven. As I understand it, about 17 different items you need to carry, kind of items, in order to be a WIC retailer. We have probably all of those within our store, but it isn't necessarily at the moment. We haven't gone to try to get them approved state by state. So that's one of the main problems. I think that the switch from voucher to smart chip has unlocked the restraint of depth of stock at the shelf like we haven't seen before. There are states, when I talk to their state WIC vendor folks, that haven't really kind of made that connection that you don't have to have that much on the shelf because people can come back and forth and not have to buy it in one sitting. And so I've had some good resonance on Capitol Hill in terms of trying to think through that harmonization. As we all know, the child nutrition reauthorization hasn't happened since I was a staffer. And so, or at least not meaningfully. And so we're a little bit of a constraint there. But I'm also trying to work with the states and the CDC to kind of help me break through some of those barriers.
So what we see with WIC, it's been on evolution, and I'm looking at safety, this is way better than I do, so I'm going to stay off the subject. But with WIC, what we're really seeing is that this evolution has happened. We've moved into technology. We're starting to see eWIC. Gordon, I would love to hear a little bit. I mean, you have eWIC in your stores. Is that correct? Your eWIC and online stuff, or just online stuff?
Just online stuff, because I think we're still in the sort of trial process. So there's a number of stores that were selected for a trial, but it hasn't sort of been finalized yet.
So to be clear, WIC is a food as medicine program. Like it is. It always has been. It's medically tailored groceries for women and children and those who need it most. So now moving into, we're touching on some themes here, kind of switching gears here to urban and rural, because the types of foods, how people shop. Tell me a little bit here Steve, a little more on rural shopping experience. What does that look like? And how does the stores look different than the urban experience?
I don't think they actually look different, urban and rural. Basically, the super sauce of ours is that it's the commonalities between it all are helpful. So again, rural stores started 1955 was our first actual retail store, still operating today in rural Kentucky. The urban centers, competition, the whole profile is a little bit different in urban sectors than it is in some of the rural areas. We've had some interest. I don't know if you want me to get into Little Rock and some of the partnerships we've been able to make in the urban setting versus rural or.
Yeah, we'll get there in a second. I'm trying to set the stage of when we think about rural food retail. Like, for example, online SNAP has worked quite well in the cities, but it has very different challenges in the rural environment. I would love to hear your perspective.
I think certainly on our bit with us, one of the big changes we've made in the last few years, and we started in New York City, is really the whole multicultural offering that we put into the store. So if you go to our Bartow Avenue store in the Bronx, you'll find a global market where we have products from all over, South America in particular, and then all different countries. We've got stores in New York City with Russian, Ukrainian products. We've got Hispanic selections, etc. So we look at individual stores, and as we've been remodeling the store, we look at the demographics in a massive amount of detail, and then we sort of try and then meet the needs of the local community in that store, and that's been a big sort of innovation for us, obviously, in the last 3 years.
Great, thank you. And I think one of the things that we were learning in our research from last year related to food as medicine and pharmacies was this tremendous opportunity in the rural communities, where it would be a very effective place for pharmacy to be able to provide care and food as medicine tied into the grocery retail experience. Now I would love to, and I'm going to quote Aaron Johnson from earlier today, and I wrote it down. It turns out all of us wrote down the same quote, so I have to start with this. Relationship is the greatest currency you can have. And thank you for saying that. And I want to kind of think through, what does that look like here? Like, I want to hear about community engagement. We have seen it in Baltimore. In my 11 years, I saw many stores open and many stores closed. I saw great intentions that did not happen. And then I saw those who could kind of figure out a model for success to stay. And in the end of the day, it's all about partnerships, understanding community, not just partnerships and serving others, but really listening and understanding what the community needs and wants, and continue to adapt and change to make sure it meets the community's needs. So I really want to use these next few minutes to dig into this. What does it mean to have a community partnership? Who are you partnering? Where is that currency of gold in relationships?
Well, thank you for that question. Again, I mentioned the two relationships that happened in 2019 for me, which was their connection with the Center for Disease Control and the introduction to the nutritionist that we ultimately hired as a third party. The third thing that was sitting on my desk when I came back into the government affairs role, related to Baton Rouge. Sharon Weston-Broom, the mayor there, is phenomenal. She had her own initiative for community health and activity, and she asked if we would look at putting fresh produce. Again, we hadn't had fresh produce in many of our stores at that moment. To consider putting fresh produce into a couple of stores that were in food insecure areas that were meaningful to her mayoral initiative. Thank God we were able to do it. And so one of those stores actually shares a parking lot with the ambulatory medical center where they do nutritional counseling for families and folks. And so they were able to try to, give them the schoolroom training about how to shop for more healthy nutrition. And then they just walk across the street, and with a couple of Dollar General gift cards, they're able to then take those lessons and put them into action immediately. That was kind of our first main win, if you will. It was a really good connection. Since then, we took the approach of adding produce. It was a bit peripatetic around the country. It all made sense in terms of why we were putting produce there, but there was no center of gravity. In 2020, I was introduced to the city of Little Rock, Arkansas. We were about to sign a contract for a new distribution center in North Little Rock. And I stumbled on this notion that the business community had tried for 2 years to find a full-size grocer to go into this disinvested part of the city. It was a big imperative for the mayor as well. And I was able to, thank God, persuade my colleagues to be able to add fresh produce to 10 of our 14 stores in that community, giving people a lot of ability to be able to, in their words, maybe not solve the problem, but to at least have a resource that's accessible to them on a daily basis.
Thank you, Gordon.
Yeah, there's two things that highlight really started in, when I was at Giant Food year, we remodeled the Alabama Avenue store. We put in a dietitian, and she's sitting in the room here today, Gillian Griffith. Now this is for Amazon, so if you want to catch up with how effective it was, speak to her. But basically, we remodeled the store, put in a whole different selection, put in a community room, a nutritionist in the store, and we started to working really closely with the community. As we were setting it up, we sort of got the community involved. What do they want? We involved the Department of Health. We did produce prescriptions there. And that really, we learned an awful lot. And say, Gillian has to take a lot of credit for that. We've done that now in Grove Hall in Boston. So we started with the community. We focused on the stores in areas where there was a high sort of, disease, obesity, diabetes, etc. Put in a nutritionist there. The nutritionist lived in the community. The store manager lived in the community. When we reopened the store, all the local community leaders were there, and the store has gone from a loss-making store to actually in a positive place where we can sort of maintain it and keep it going. So that's been, we're also doing that in the Bronx. And then the second thing we're doing is the focus as we've moved food as medicine. We've opened 250 school food pantries. So schools can apply to sort of be a food pantry school. And we go into the school, set up a food pantry. The kids in the school help us set that up, and they help serve their other pupils. And basically, we're trying to focus on healthy food where kids can go in the morning and take some food, and they can take food home with them in the evening to feed their families and themselves. And the whole thing is focused on, look, if you go to school and you're hungry, there's no way you're going to get a decent education. And for me, the way out of a lot of the challenges that people have is through education, and that can change a family and a generation. So the fact that we're about 250 at the moment, we're going to have one food pantry for each store that we have, and that's become a big part of the community work that we're doing as well.
Great, thank you so much. I want to give a shout out to Ambassador Arthur and Cousin. I read the report, of course you are a good one, but with my highlighter and pen, and really looked through all the details of what does success look like. And one of the things that I love the most in that report, and for being here today, is looking at focusing on models of success, what is working, and how do we replicate or learn what to replicate and what may not be replicated in our communities, in our stores, understanding, as we already all know, that there is no one perfect store, never will be, never was. And that we need to have this relationship between the brick and mortar stores of all different sizes and scales, from nonprofit to for-profit, to rural, to urban, to online, that we need that full experience. To be able to see success in this nation, we need to be able to feed our nation in a culturally appropriate way. And thank you so much for today's panelists who really discuss what is the nuance of what does food retail look like on the ground. So thank you so much.